Bachelor of Science Nursing Microbiology Unit 4, Immunization for various diseases and immunization schedule. Immunization is the process of making an individual immune to infectious diseases by administering vaccines. It helps prevent the spread of diseases and reduces mortality rates, especially in infants and children. Immunization can be active through vaccines or passive through antibodies or immunoglobulins. Immunization for various diseases. Different vaccines provide protection against specific diseases. Below is a list of major vaccine-preventable diseases and the corresponding vaccines: tuberculosis, TB vaccine, Bacillus Calmette-Guerin, BCG, route intradermal dose, 0.1 milliliters. Protection prevents severe forms of tuberculosis, including TB meningitis. Poliomyelitis vaccines, oral polio vaccine, OPV, live attenuated vaccine given orally. Inactivated polio vaccine, IPV, killed virus vaccine given intramuscularly. Protection prevents polio and its complications like paralysis. Diphtheria, pertussis and tetanus, DPT vaccine, DPT, diphtheria, pertussis and tetanus, or pentavalent vaccine, DPT plus hepatitis B plus Haemophilus influenzae type B, route, intramuscular dose, 0.5 milliliters. Protection, diphtheria, prevents throat and respiratory infections. Pertussis, whooping cough, reduces severe coughing fits. Tetanus, protects against muscle stiffness and lockjaw. Hepatitis B vaccine, hepatitis B vaccine, route, intramuscular dose, 0.5 milliliters. Protection prevents liver infections caused by the hepatitis B virus. Measles, mumps and rubella, MMR vaccine. MMR vaccine route, subcutaneous dose, 0.5 milliliters. Protection, measles, prevents rash, pneumonia and brain complications. Mumps, reduces swelling of salivary glands. Rubella, German measles, prevents birth defects if a pregnant woman is infected. Influenza vaccine, route, intramuscular dose, 0.5 milliliters. Protection reduces the risk of seasonal flu and its complications. Human papillomavirus, HPV, cervical cancer vaccine, HPV vaccine route, intramuscular dose, 0.5 milliliters. Protection prevents cervical cancer and genital warts. Rotavirus vaccine, route, oral dose, 1.5 milliliters. Protection prevents severe diarrhea in infants and young children. Typhoid vaccine, typhoid conjugate vaccine, TCV, route, intramuscular dose, 0.5 milliliters. Protection prevents typhoid fever caused by Salmonella typhi. COVID-19 vaccines, Covaxin, Covishield, Pfizer, Moderna, Sinovac, etc. Route, intramuscular dose, varies based on the vaccine type. Protection reduces severity and mortality due to SARS-CoV-2 infection. Immunization schedule, National Immunization Schedule, India. The immunization schedule varies by country, but here is an example based on the Universal Immunization Programme, UIP, in India as given below. Importance of immunization: prevents deadly infectious diseases, reduces childhood mortality rates, provides herd immunity, protecting unvaccinated individuals, cost-effective in disease prevention, helps in the eradication of diseases, e.g. smallpox, polio in many countries. Conclusion: immunization is a vital public health measure for disease prevention. Following the recommended immunization schedule ensures protection against infectious diseases, leading to a healthier population. Proper vaccine storage, handling and administration are crucial to maintaining vaccine effectiveness.